I'm Dr. Mohammed Sheraz Raza. Assalamu alaikum, everybody. Thank you, Uncle Chima, for having me over again. I'm coming after 4 years, I think more than 4 years, COVID and everything. And my profession, my practice has changed dramatically over last 4 years. When I came last time, I was an assistant professor of plastic surgery and heading the hand and microsurgery department in Jinnah Burn Center. And that was all I wanted to do for the rest of my life. But over period, Allah ki raza, mere parents ki duaon ki wajah se, by the way, I'm son of Dr. Talib Hussain Man, one of your colleagues. So now my practice is almost 98 to 99% cosmetic surgery, private practice. How it happened, I have absolutely no idea. Cosmetic surgery का journey मेरा इस तरह start हुआ कि I did a fellowship in cosmetic and facial reconstructive surgery from Dutch Association of Facial Plastic Surgery, Holland, Rotterdam. And I thought I'll just keep it with myself. So actually मुझे job नहीं मिल रही थी, मुझे medical officer की appointment हुई थी in Shadra as a plastic surgeon, as a microsurgeon, jahan there was no department. So I thought okay, I'll spend one more year learning a few things, and that's when I did aesthetics. And wahan se the journey kept on, and I told you, a huge accolade to Umar Hospital and Dr. Abdulaziz Rana, another friend of my father's and Chima Saab's. Everything I owe to this profession is because of them. They've had faith in me. They allowed me to practice in Umar Hospital, and now I have a practice which has around 99% of aesthetics, and last year I won the prize for best rhinoplasty surgeon in Southeast Asia, and so that's my brief introduction. So without any further ado, हमारा topic जो है, I'll be very casual. I've tried to keep it brief, pictorial, and tried not to show graphic stuff as well, because not everybody is comfortable with kind of the work we do, the surgeons do, the blood and exposure. So what is basically aesthetics kya hai? Aesthetic surgery. What is aesthetic surgery? What is cosmetic surgery? What is aesthetic procedures itself? बहुत सी myths हैं. A lot of people think different things about us. बहुत से लोगों का ख्याल है कि ये तो जो कुछ नहीं कर सकते ना वो ये कर लेते हैं, because इसमें कोई technicality नहीं होती, बस गपशप होती है. गपशप से आप किसी को impress कर लेते हो तो ठीक हो जाता है. कुछ लोगों का ख्याल है कि जी ये अमीरों के चोंचले हैं कि जी जिन्होंने पैसे वेस्ट करने होते हैं तो वो cosmetic surgery करा लेते हैं. And then a lot of people think कि, और बहुत परेशानी भी होती है कि जी जिसने अपने मुंह का बेड़ा गर्क कराना होता है ना वो cosmetic surgery करा लेता है. माइकल जैक्सन को देखें, फलाने एक्टर को देखें, फला. So I think the basic जो मैं concept लेके आया हूँ, the basic thing I've brought to our senior faculty here is that we do far more than that. It is as important a specialty as any other, if I must say. So, disclosure, I have absolutely no personal or financial gains from this presentation. All the photographs are my personal patients, my own personal patients from whom I've taken written consent to use it academically, and some of the photographs have been taken from the Google. So this is basically roughly what I'll be talking about. You can stop me whenever you get bored. I will try not to bore you. So what is aesthetics? Aesthetics, aesthetically, tum bade achhe lag rahe ho, aesthetics is this. So what is the definition of aesthetics? Aesthetics is the philosophical theory or set of principles governing the idea of beauty at a given time and place, adopted by a particular person, group, or culture. In other words, a particular taste for or approach to what is pleasing to sense, especially sight. So जो चीज आंख को अच्छी लगती है वो aesthetically correct अच्छी होती है, और जो लगती, so it's extremely subjective, it's extremely relative. There is no absolute definition of aesthetics that makes this field more interesting, at the same time extremely hard to practice, because you have to get into the minds of your patients, your clients, to understand what they have come to expect from you. And cosmetic surgery, plastic surgery में क्या फ़र्क है? Basically कोई फ़र्क नहीं है. A very famous teacher of mine, John Hamra, who was one of the who first devised facelift surgery, he told me there is no reconstructive surgery without cosmesis, and there is no cosmetic surgery without reconstruction. So whatever we are reconstructing, we have to get an aesthetic sense, make an aesthetic sense of it. Or whatever we do cosmetic surgery, it should not embark on function. It should not compromise the function. So no form before function. The function needs to be the priority. Agar hamara aesthetic procedure affects the function, then it's a failure. So plastic surgery is a vague term. Reconstructive, specifically when we are reconstructing a patient, burn, tumors, accidents and everything, but we still have to keep aesthetics in mind. We have to reconstruct it in the parameters of aesthetics and beauty. And cosmetic surgery is when there is no trauma, there is no deformity, but it is not aesthetically correct according to our definition or client's definition, then we go ahead and do it. So cosmetic surgery, as I've just said, it starts from head to toe, from hair to forehead to eyebrows, eyelids, nose, nasojugal lines, cheekbones, chin, breasts, arms, body. So it encompasses everything. You name and a procedure has been defined for it. But why? Why is aesthetic surgery even necessary? So I wouldn't go into details anywhere, but the history of beauty is as old as mankind. शुरू से ही इंसान wants to look good. I think जब हम पैदा होते हैं, जो ही शऊर आता है, I think बाल बनाना सबसे पहले शुरू कर देते हैं. Even नबी पाक सल्लल्लाहु अलैहि वसल्लम खत बनवाया करते थे, बाल को कंघी किया करते थे. He always had. तो aesthetics is all about that. ऐसा नहीं है कि it is changing Allah's form or anything. It's just उसको enhance करना. And as early as 800 BC, physicians in India were developing the techniques for plastic surgery. Skin grafting developed, ki nose ki reshaping ke liye they developed these huge gauges which used to enhance it, chin and jawline, and then it moved onwards. So it is nothing new or recent. So why to do cosmetic surgery? I'll tell you my philosophy. I think every physician, every consultant has a philosophy in their life, the way they practice. The goal of cosmetic surgery is to improve a person's appearance, self-esteem, and self-confidence. Cosmetic surgery can be performed on any part of the body and the face. So basically, we are treating minds. So we are treating minds and we are treating souls. Anything which scars a person, every time somebody looks into the mirror and thinks कि यार ये वाली चीज़ मेरी जो है ना मुझे अच्छी नहीं लगती, या somebody is constantly gazing at me because of that part, ये ठीक हो जाती ना तो I would have been a far better person. ये भी ठीक हो जाती तो मैं ज़्यादा खूबसूरत लगता and everything. So we really have to make sure that we understand कि what is the implication of that deformity. I'll start with this example. This is a patient I recently did. So this gentleman is a final year MBBS student, and I took his permission. So he had his nose the other way around. It's piggy nose. So throughout his childhood, he had been bullied for this kind of a nose, that it looks like a piggy nose, and all kinds of names people think. And he came to me and he said, Doctor Sahab, I've been taking antidepressants for the last 8 years. If this nose gets better, तो शायद I will be saved. And this photograph was taken exactly 3 weeks later. Still there are certain stitches out. And he said, today, this week, for the first time, I skipped my antidepressants. I think I'm complete again. So it is rewarding. It is not a useless specialty. It's not just for treating the face. It is treating souls. So without any further ado, I go to our topics. I will be showing you basically what is done and when it's done. I wouldn't be going into details how it's going. Of course, it's not going to affect you. Why it should be done, that is important. So face जो है, face I think is we always think मेरा ख्याल सबसे ज़्यादा care हम अपने face की करते हैं. Everybody does. We men, we shave, खत बनवाते हैं, ख़वातीन facial कराती हैं, they get their eyebrows done and everything. So face is something which is very very important for our appearance. हम मोटे हो जाएं लेकिन चेहरे का बहुत ख्याल रखते हैं, हम पतले हो जाएं लेकिन चेहरे को we want everything. So aesthetics in face is supposed to be important. And as Faiz Saab said, तेरी सूरत से है आलम में बहारों को सबात, तेरी आंखों के सिवा दुनिया में रखा क्या है. So poets would have been out of job अगर चेहरे की खूबसूरती नहीं होती. So that's one credit to that. So face को importance हमेशा से रही. In 1452 to 1590, Leonardo da Vinci took so many years to make Mona Lisa, and it stands as a masterpiece still in the whole of the world. It's considered as the best masterpiece. Why? Because it shows a face which is 3D in 2D, and it's a beautiful face with a beautiful smile and glowing eyes. So how do we assess? Face को assess कैसे करते हैं? For example, if somebody comes to you and says कि जी, what can be done on my face? Yeah, how does my face look? So how to assess it? So we assess it in the following headings. We see the proportions. The proportions of the face, we measure them vertically downwards as well as horizontally sideways, and we say what are the proportions of different parts of the face, the symmetry between two sides of the face. There was a time when there was data that 93% of faces in the world are asymmetrical. Only 7% are symmetrical, and those 7% have never won the most beautiful contest. So it's not about perfect symmetry, but it's about asymmetry in harmony with different parts, the complexion, the texture, and irregularities. So we surgeons, we need to have a guideline. It's very difficult to be an artist. Actually, I never count myself an artist. I was terrible at drawings. But we have to be mathematicians. And what mathematicians is, this is a very old Proclus facial image in which he tried to find out the ratios and angles of every part of the face with other part to make a perfect face. So it stayed in vogue for a really long period of time, and people tried to make it according to that. But at the end of the day, it was realized that it's absolutely not about symmetry. It's not about ratios. It's not. You just have to look pleasant, and that's the whole principle we work on. So this is what I said. So usual symmetry जो हम देखते हैं वो देखते हैं हमारी hairline से लेकर हमारी eyebrows से base of the nose and nose से chin. These should be equal. If it's not equal, then nose should not be bigger than the lower half. Otherwise, it will become too big and it will express itself. So aesthetics क्या है? Aesthetics ऐसी चीज़ है कि when you look at somebody, he should look very, very good. But at the same time, you cannot pick कि ये वाली चीज़ ज़्यादा खूबसूरत है या ये वाली चीज़. Nose खूबसूरत है, eyes खूबसूरत है. But they should look aesthetically nice individually, as a whole person. चाहे individually कोई body part जो है वो special ना हो. Other is vertical, that we see what is the symmetry. The distance between two eyes should be equal to the base of the nose, should be equal to the base of the chin. This is what matters the most when you assess the nose. And secondly, if you draw a line, mid-pupillary line, like mid of the pupil, then the lips should end at that time. These are the parameters I usually keep in mind when I'm doing that. So these are patients. Now I'll talk about patients. So what are the most common cosmetic surgery procedures? आपके ख्याल में in your practice बच्चे भी हैं, सब भी है, आपके पास अब सबसे ज़्यादा लोग अपनी किस बॉडी फेस पार्ट को से बॉदर होते हैं कि यार ये चेंज होनी चाहिए? Of course, because you put your nose where it doesn't belong. So nose is so obvious. I mean, आप ना भी चाहें तो nose, frankly, it's my professional hazard. लेकिन everybody should, you have a look at the nose, right? So nose is the most important part of the face, I feel, for younger people, and they are from the younger lot, the most people who come here for procedures to me are for nose jobs, and I do a lot of them. I even have a clinic in Istanbul for that. So this young gentleman came to me and he was to get married in 3 months, and he said कि जी मुझे ये nose जो है ना जितना small हो सके and जितना narrow हो सके और perfect हो सके, I want that. He was a very panicky patient, so I excused myself because I say कि if somebody is too overwhelmed by what he wants, so you excuse yourself. But he came back 2 to 3 times, and I finally took it up, and we gave him the nose. This is just 2 months after the surgery. The falling of the tip is better. The angles are better. The forehead to nose line is better. As I already said, the distance between the two eyes should be equal to the base of the nose. And you should have a straight nose starting from just above the eyelashes line to the tip. So he feels the whole world is changed for him. He's one happy person. Another gentleman, he had a crooked nose like a beak. There was a hump and everything. We just straightened the nose and got him on the way. Usually results, kisi zamane mein used to say 6 months to 1 year, but now 6 weeks onwards, your final results start appearing, and they last for the lifetime. Similarly, women, this young beautiful girl, she had vaginous granulomatosis, due to which the whole nose was collapsed, the bridge was collapsed. So I reconstructed the whole framework with one of her costal cartilages and gave her a straight nose from the side view, and she's a blogger and a YouTuber, so she has to be picture perfect at all the time. This lady, she came and she said, Doctor Saab, once in my life, I want people not to call me a parrot. Can you just change that? And that was a difficult proposition because people will keep calling you what they used to call you at childhood. But we gave her a try, and people do not. I mean, not a lot of people call her parrot anymore. Next thing is ears. What other things can we do to the ear? Actually, I would leave the details and the technicality for you to ask me later. So I'll just show you कि क्या होता है, so that we understand कि why do we do it and what's done. So a lot of people you would see have bat ears. They have ears who are looking forwards, and they look terrible. No matter what you say, they take all the attention. No matter how beautiful your eyes, nose, and face are, they look terrible. And a simple procedure in the local anesthesia, otoplasty. So what is prominent ear? That your concha is too big, so it doesn't allow the ears to settle on the neck. Number one. Number two, your antihelix is not formed. It's flat. So that is why the ring is bigger. So what you do is you create an antihelix. You create antihelix, and you take out a crescent from the cartilage and put it sideways. So it goes back, goes there for permanence. I've started doing them in as younger children as possible so that children do not bully them from the start. So it's a very rewarding procedure. Another thing, sometimes the shape of the lobule is not good, or sometimes it is gone. We can reciprocate the other side. We can create the lobules exactly the way our clients want them. Then fillers and Botox. That is the tasty part. So fillers and Botox, kya hai? I think I would dwell a little. I'll take a little more time. Filler, as the name says, it's supposed to fill, but actually the philosophy is far from that now. So fillers can be synthetic, can be natural. Natural filler is fat. आपकी अपनी fat को हम जहाँ भी fix कर देते हैं. It takes blood supply. It stays there. It increases with when you gain weight. It decreases when you lose weight. Then synthetic में there are temporary fillers like hyaluronic acid, and there are permanent fillers like calcium hydroxyapatite. Anyways, we wouldn't go into detail. So basically, what I just said is that you cannot really tell what I did in this client. I mean, not really can point a finger there, but just by global optimization, by HI fillers, hyaluronic acid fillers, around 7 mils of them, she starts looking, the 7th day when she comes to me, she starts looking much happier, pleasanter, and much less sad. Similarly, the jowls that they develop, so we can get rid of the laugh lines and jowls with threads. So basically, purpose is not to make a face flat, because wrinkles do not mean that we're ugly. Wrinkles mean that we have lived a very expressive life. We have expressed all our life. So the target is not to make the face too flat or inexpressive. The target is to make it look pleasant. And we live in an era of selfies and photographs. Nothing goes unchecked. So people want to be picture perfect to get rid of these jowls and everything. So in her, I added some filler here. I did the thread lift of her face, and this is the same day. The results same day, and you can have the results same way. So usually the younger clients, they would not want a scar. They cannot have downtime. So we do these procedures, injectables, Botox, and fillers to make them look less tired and more symmetrical and without much downtime. The more the age, the surgical procedures start taking over. This is another client. She's a doctor in Rawalpindi, and she came to me and said, "Doctor Sahab, mera chehra bada karakht lagta hai." You cannot pinpoint one thing what is wrong or right in this face. All I did was, again, 9 mils of fillers here and there, and just to loosen up and just to make the face softer. So she was really happy that she looks softer now with more pronounced lips than the way she used to look before. These photographs have been taken 1 hour apart, by the way. Another face, she's a business executive. She traveled all the way from Dubai to me, and she said, "Doctor, I've got a very chubby face. Aap meri face ki liposuction kar sakte hain?" And I said, "No, I cannot, because nobody can do that, because face ki liposuction nahi hoti. You can take out a chunk of the fat from somewhere, but liposuction nahi kar sakte because facial nerve hai." So maine kaha, why don't I make your face slimmer by injectables? So I injected her masseters to make the jawline thinner. I gave her a bit of a chin so that jowls do not get pronounced. I made her forehead flatter so the eyebrows get a little lifted. And finally, I did threads for her lip and nose so that they get a little lifted, and I don't know how you like it, but I really like the way she looks younger and youthful. This gentleman is a TV actor, and he used to say that every time I'm on screen, my double chin starts coming into my way. So I did his chin implant. So whenever we see a retruded or small chin, that again makes the proportion off. So I do a lot of implants as well, chin implants, mandibular implants, malar implants, just to make it aesthetically perfect. Do remind me at the end of the day, I would give you a description, very short description, how aesthetics in a female differ from aesthetics in a male, because that is, I think, the most important part, which a lot of aesthetic physicians forget when they do. So they make a masculine face feminine, they make a feminine face masculine, वैसे straight jawline होती है, सब कुछ होता है, but it doesn't suit with their genders. Acne scarrings, ये last time भी मैं present करके गया था. Acne scarring is something our kids, our girls, they suffer a lot, even men actually, with modern diets, with refined diets and sugars and everything. Acne बहुत common, nodular cystic acne can develop. So a lot of things have been developed. For me, a lot of people would say a lot of things, but I would say nano fat combination with PRP and microneedling works the best in my hand. So I take their own fat, I emulsify it so the cells are separated from the lipids, and then I inject them under the dermis, because the apocrine glands which got infected cause the scarring is under the skin. They are not in the skin. And I make a plane underneath, I add the nano fat, I do a microneedling, and usually this is nano fat, this is PRP, and usually you get pretty good results. So you get pretty good results. Actually, this is after one session of nano fat and microneedling. So they do really well, and I think it works. It's something. It's a public service sort of a thing, because our girls really feel bad about their scars. Similarly, hair loss, PRPs, I don't do it anymore. I don't have the time for it, but it does work till a certain amount. And now there are newer and newer techniques. There is a new technique called, I was recently introduced to it, called Regenera Activa. It takes your ectodermal growth cells. For the first time, there are ectodermal growth factors. They multiply it, they inject it back, and the results are pretty promising so far. So, aging face. एक और concept ये है कि जी जवान लोगों के लिए तो plastic surgery नहीं है, ये तो aging face के लिए होनी चाहिए to make them look younger. पहली बात तो ये है कि we cannot make them look the way they used to look when they were younger. Why? Because 73% of changes which occur in our faces with aging are in bone. Our bone resorbs. Our bones resorbs. So जब सांचा छोटा हो जाता है तो everything on it becomes loose and it moves down. So even if we pull it up, तो skeleton उतना ही रहेगा, so you would not look the way you used to look younger. So we have to be very clear with our clients that do not bring a photograph of your youth. We cannot make you that way. We can make you look fresher and pleasant for your current age. So what are the signs of aging? I think that is important for anybody. So the signs of aging is, I always divide it into three parts: forehead, mid face, and lower face. The forehead, जब हमारी ये bone resorb होती है in the forehead, so what it does is that it causes the eyebrows to flatten, the eyebrows to go down. Because the eyebrows are going down, the forehead muscle, the frontalis, tries to keep it pulled up so that they do not come into the way of vision. And in that process, you develop wrinkles. And unfortunately, without studying this pattern, a lot of our colleagues, they inject these lines with Botox so that these lines should disappear. So the lines do disappear, but the brow goes down, which worsens the upper eyelid hooding, dermatochalasis. So upper eyelid becomes looser. Actually, you have to be very careful with Botox because it is irreversible. And so the second sign is, the first is wrinkling, then the eyebrows become droopy, they become flatter in women, and they become even further droopy for men. The shape of the eye changes. Vertically it increases. You develop eye bags. The malar, this tear trough that we see, that there is a trough which along which the tear drops, the face goes down, the folds become deeper, and finally you develop jowl and pre-jowl services. So in the literature says, and in our practice as well, the forehead does very well with non-surgical ways. You can do it with Botox technically and fillers. The mid face, that needs surgery plus non-surgical, and the lower face and neck, it does not respond to non-surgical. You can buy time in months, but you ultimately have to go for a facelift to do that. So these are the aging signs which develop over time. So what are the most common procedures in face that are done in my practice and in international practices is blepharoplasties. That is upper blepharoplasty and lower blepharoplasty. What is blepharoplasty? That you take out, in upper eyelid, you take out the extra skin and muscle which is making a hooding on the eyelids and which prevents women from doing the eyeshadow makeup क्योंकि वो इतना छोटा part हो जाता है, you cannot wear it. So you can make it brighter, and in the same go, you lift the eyebrow. So this is a very famous endocrinologist. I have all his permission, a very dear friend of mine. So one day I was sitting and he just said, okay, Sheraz, मेरी कुछ हो सकता है? My kids मेरे मजाक उड़ाते हैं that my eye bags, I'm always working, that's why I'm earning money, and that's why. So I did his blepharoplasty the same day, and there's tear trough and is gone. This guy traveled all the way from US to get his lower eyelids done. So I did his upper and lower eyelids. So I did the eye bags were very prominent. So I got rid of the eye bags. I usually do not remove the fat. It's a myth कि आप lower blepharoplasty में you remove the fat. We do not remove the fat. We just redisplace it into the cheeks to give the volume to the cheek. Another lady, she's congenital. She's not very old, but she congenitally had small eyes and eye bags, upper and lower eyelid bags. So I did her upper and lower blepharoplasty, and the eyes become far rested, youthful, and pleasant. Another lady, again, you can see this is what I meant, that this area is very little for wearing a makeup. So ladies want a bit bigger sulcus. So we did the blepharoplasty and we lifted the brow high so they look youthful. So blepharoplasty is a very major stay of our treatment because that shows and doesn't go away with non-invasive procedures. Again, blepharoplasties, upper and lower blepharoplasty. The lower blepharoplasty, the lady was kind enough to come all the way from Norway to get it done, and this is brother-in-law of a very dear friend of mine, and he works a night shift, so he had eye bags at an age of 33, so I did his blepharoplasties. So we make them plain and they do not look like sad and puffy anymore. Then facelift. What exactly is facelift? Facelift एक myth है. We have been hearing it since Noor Jahan's days when she used to wear a collar because. So when it started, तो concept था कि भाई wrinkle नहीं होना चाहिए, loose नहीं होना चाहिए, जिस मर्जी angle पे उसको आप tight कर दें. So Noor Jahan used to get tighter in neck, and she used to wear a diamond in the collar. But gradually people realized कि ये तो आप वही कर रहे हो जो actually nature आपको aging में करी है. You're bringing everything down your way. So then we started putting it higher. So I did his blepharoplasties and I did her facelift and neck lift to make the jawline straight. And again, there is a difference between a male and a female face. The male face goes backwards, the female face goes vertical and goes more narrower. For example, this lady, she's a doctor, a gynecologist, a pretty famous one, and she came to me and she said, "Doctor, I'm not even married, but this is how I look right now. Can you make me look?" So again, I did blepharoplasties. I lifted the eyebrows. I did the facelift to give a heart-shaped face, and then I did her lips and under eyes for her to look far. I mean, not really younger, but of her own age rather than that. Then we can keep talking about face all day, and we will talk a little more later, but I think we have to move on because there are a few more bases to touch, because I just want you to introduce what exactly is done and being done so that you can study it, you can refer and understand. So aesthetics and body. So at times in a society like ours, हमें लगता है कि खूबसूरती is just face. Face के अलावा there is nothing that is important in our body. But the trends are changing and they keep changing. मोटापा किसी को अच्छा नहीं लगता, truncal obesity किसी को अच्छी नहीं लगती. So everybody wants to be in a shape. Again, selfie culture has changed our way of living a lot. Everybody wants to look at the sharpest at all times because you're not getting away with the selfies and the photographs. So I tried not to put the actual breast augmentation photographs. Breast augmentation is one of the mainstays of my practice. There are a lot of girls coming because a lot of our kids are going abroad at an early age. They go after A-levels and they study there, and when they go there, the culture there, they feel very compromised. They feel very underconfident. I have a talk on it on YouTube if you go read about it in details. It's about the emotional aspect of breast. How incomplete a woman feels when she does not have breast. कोई male शायद ये understand नहीं कर सकता. But how incomplete a woman feels when she does not have properly developed breasts. So it's a mainstay of our practice. So we do put it under the gland. I mostly put all my implants under the muscle, and they give a fantastic result. They're totally safe. There are absolutely no risks available with it. I have the data of all the cases I've done so far, and people travel from here. They're all kind of backgrounds. It doesn't necessarily have to be rich kids, poor kids. Every girl wants to have proper size breast so that she can feel a complete woman. Uski reason मैं आपको later बताऊंगा. A research I did about it. On the contrary, the men do not want breasts. They are absolutely concerned. They're a matter of concern for them, that because male boobs or gynecomastia. So they cannot wear tighter t-shirts, even when they're wearing summer wear. They have to be very careful the way they look. They could not go to pool and everything. Younger and younger boys are coming with gynecomastia now. And I always say, whatever the cause, they need to go. We have to take care of them, because again, you cannot put a youngster in this awkward position that he's always wary what he's wearing. He's going to sweat and this is going to start looking that way. Then people are going abroad. So the common locker rooms and everything. So gynecomastia surgery is again very, very rewarding, and I don't call it cosmetic anymore. I think it's more reconstructive. Breast lift surgery. So there has been a recent trend in which I see younger girls and older women who come with very, very large breast sizes. Initially, because of the culture, shame, and they used to stay home. They used to have back pains, neck pains, all sorts. I have done so many J sizes, double J sizes, the breast getting all the way to your thighs and done reduction in them, and it makes their lives very, very easy. So I think if I can make one point, is that this is again not really a totally cosmetic surgery. It is a reconstructive surgery, because it prevents from a lot of back pains, disc problems, and another thing. And in addition, you do not get a lot of public attention. You know, the way people are around the world, they gaze at you and you feel uncomfortable. You have to dress up in a specific way to hide. So I do a lot of breast lifts and and mastopexies in older women, because that gives them a perkier figure that they've always been wanting. So this is a lady. She was a TV actress. Then she gave birth to 2 children, and then she came to me and she said that, can I have a body like Kim Kardashian? And I said, no, you cannot, but I'll give you something that you probably would near that. So this is 4 weeks after the procedure. I did her tummy tuck, breast augmentation, 360 liposuction, and this is 6 weeks later when she's on her vacation to Maldives. Liposuction. So liposuction, what is liposuction? That needs to be understood. I think I have to drill it in today. Liposuction obesity ka treatment nahi hai. It is absolutely not a treatment for obesity. It is a treatment when you are on a good diet, healthy lifestyle, and still not losing fat from certain areas. Our men often develop in tummy. Our women get buttocks, arms. So isolated areas. So basically the concept of liposuction is gone. It's now liposculpting, that we sculpt bodies by liposuction techniques. The bodies that are safe, that they're in shape enough, but we kind of take out the extra fat and everything, and they become better. This gentleman actually is a coach of the boxer Amir Khan. So he came over, and shadiyan thi, so he kept eating, and then he finally became that when he wanted to go back, not looking like a fool. The new trend, the new beast. Okay, so अभी हम liposuction पे ही बैठे हुए थे कि जी हमने trim करना है, slim करना है, and people wanted HD liposuction. So for that purpose, I had to travel to Colombia, because Robert Cotofona is a surgeon who is doing a lot of this work, and people were asking me more and more if I could do HD liposuction, create abs, pectorals, and muscles, so that they do not have to work out and still look in shape, because Salman Khan doesn't wear a shirt. So this is the first case I did. So I did his liposuction, I created his abs, I took out gynecomastia, I injected fat under his muscles, and this is side view. So I think it's a good enough. I've gotten better since, but I think it's a good enough result for HD body sculpting. You can hardly tell it's a bodybuilding or the liposuction. Another patient, he said, I've been working out and everything, but I just cannot get my abs. So I gave him abs. This is just 1 month after the lipo sculpture. And if he takes good care of himself, I think it'll stay for a while, actually. So it's not just men. The women want more and more sporty look now. The girls are going abroad. The girls are wearing all sorts of, there is newer cultures, newer fashion, newer trends. So I don't judge people for what they want things for. But women want quite sporty bodies as well. So we've started sculpting female bodies. Again, it is important to understand the difference between a male and a female body to give them accordingly, rather than making a woman's body masculine and the other way around. Another thing that I never thought I'd do, I wasn't trained for it even, is aesthetic gynecology, but I was brought into it because I realized that there is a need for it. Why? Because there's hardly anybody who's doing it, number one. Number two, the ones who are doing it are doing a terrible job at it. They're not trained, and they're often not even doctors. Because हमारे यहाँ culture, not हमारे यहाँ, everywhere, there's a lot of culture of genital mutilation in younger girls. हमारे भी backward areas में किया जाता है and everything. So the genitalia lose their form. So as I just said, that just like breast, a woman would not feel comfortable with herself if her genitals are not appropriate. I know it's a touchy topic, it's sensitive, and often people say, they can't dikhta hai, what does it matter? But it does matter to the person who has them. So psychological impact. So what is the psychological impact? So I wanted to tell you about this in the discussion of breast, so I'll go back again on it. So I did a countrywide research on breast reconstruction in women. So what we did was that we put a questionnaire in every center in Pakistan who were doing breast surgeries, like breast cancer surgeries, breast reconstruction surgeries. So we asked the ladies to give a score from 1 to 10, that how shy do they feel when a male doctor examines them, even in the presence of a chaperone. And they used to give a score. So the score was around 9 out of 10 when they had breast cancers, huge lumps in the breasts, fungating masses, but they still were uncomfortable showing it to the doctors, because that's how our shame things work. They do not like to expose themselves, which is very natural, should be like that. Then we did mastectomies, and we did the score of the same ladies again, and we realized the score fell down to 3 by 10. So they hardly felt any shame exposing, because they did not have breasts. So they didn't think that they're even women. So they would just open the dress and show, jo aksar ye scar hai, koi baat nahi, parde ke piche jaane ki bhi zarurat nahi hai, because they thought they do not even look like a woman without breasts. Then we did the score again once we reconstructed the breast with muscles, implants, or whatever. And the data is of 700 patients, and we saw that the result went back up to 7. That with that breast, that was not their natural breast, they knew it was reconstructed and it was on their body, they still felt shameful exposing it. And finally, when nipple areola was reconstructed as well, the score went all the way back to 9. So that's the point, is that it is this important for a woman to feel like a woman, to have proper private parts, that is breasts and genitalia, which are overlooked. They have, because of shyness, they keep suffering. The men are at times not very tolerant. They keep giving tough time to their wives after they have given birth to children. So that's when I thought that aesthetic gynecology needs to be taken over. This was a documentary that I saw when I was planning to do a small fellowship in this. That this was a program on BBC by Tracy Plowman, The Perfect Vagina. So there is no one can force anyone to go for surgery. The way we treat patients, if it affects them psychologically, and we help them, why not? If the excess skin is there, you want to trim it, then trim it. Similarly, the people say that if hair transplant can be done, because of course they're not doing any purpose but for genitals, then why not surgery of the genitals when a woman wants to look good? So what is an aesthetically good looking genitals or aesthetically sound? So an aesthetically sound, so there is a definition about it, that aesthetically sound vagina is, it starts from non-pubis, the distribution of hair. So you should not, at the end of the procedure or in general, they shouldn't go very high, very low, not on those. So no procedure should be done so that the distribution of hair is gone. Then there is labia majora. Labia majora is this fat portion. This gets affected the most the most and most. And that kind of, what it does is that the imperfections within these labia majora, they become exposed. Actually, labia majora should be well-rounded and cover everything else. If that's good volumed, koi issue nahi hai. Andar jo bhi hai, doesn't matter. But they become atrophic over a period of time, they lose volume and they become totally flat. So the genitalia, they don't become a part of genitalia anymore, and this becomes, clitoris becomes elongated, goes downwards, the openings become bigger, and after episiotomies, there is perineal defects as well. So what does aesthetic gynecology include? The procedure. So what impact does it have? So of course we cannot do our research here, so I always quote researchers wherever they're done. So what affects the most in personality and in intimacy issues in married people? Vulva appearance dissatisfaction is number one. Genital image self-consciousness. Woman herself feels that she looks ugly because the labia minora, they becomes either very big, black, or flappy, and they kind of flap around, I don't know, very nice, and they cover and uncover. And motivation to avoid risky sex, sexual esteem, and sexual satisfaction. So husband and wife, they move apart, of course. Again, a very touchy topic, but somebody has to cater them. So these things can be resolved if you do very minor procedures. And I repeat myself, very minor procedures. You're not altering anything, you're not violating anything, and you are restoring youthful appearance of the genitals. So the most common, again, I wouldn't show the photograph, that would be too graphic for presentation. So you do PRP and grafting. So labia majora, as I said, when they lose volume, the best thing you can do is you fill them again with fat, fillers, and PRP, so that the skin quality becomes softer and it kind of covers them. Then vaginalplasty and perineoplasty, that occurs when multiple pregnancies, and especially when episiotomies have been done and not in the best possible way. The perineum also gets torn, and you need to repair the whole thing from inside out to achieve the competence of the vagina and as well as the perineum. And finally, labiaplasty. This it can be done under local anesthesia, and single most important step which can be performed, and the genitals look from extremely ugly to quite pleasant. A lot of people doing gynecoloplasty, I don't personally do it for my own personal reasons, for religious reasons or whatever reasons. I do not do them. I'm not against them or in favor of them, so I wouldn't discuss them. But these things are totally halal. If a woman is feeling psychological problems and you have no idea how they feel about it, then by these procedures, if you can give them a new life, a happier status with their spouses, then why not? So this, ye mota tha, that's what I do or what's done and what can be done. You can ask me the details, technicalities, diagnosis ke bare mein, parameters ke bare mein. I'll answer everything. I'm pretty good at that. But an important thing which I teach all my students, as I've recently started in fellowship in cosmetic surgery as well. By the way, I was the first supervisor of FCPS hand surgery. I made the curriculum for it, and then they sent me to Sialkot where there was no microscope, so I had to. I was the only one, so I didn't continue. Anyways, so when to do and when not to do cosmetic surgery, I think the most important thing is when not to do cosmetic surgery, when to say no, because everybody who does aesthetics will get into trouble one day. You all are bound to do that. We have been there, we're going to be there, repeat time and time again, when we do not assess our patient properly. So psychosocial and psychological assessment is very important. So what are the aspects for which you should say no to cosmetic surgery or cosmetic procedures for that matters? Unrealistic expectations. So I always ask my clients that why do you want to get it done? There are innumerable young girls coming with their parents and they say कि जी शादी नहीं हो रही तो हम सोच रहे हैं कि ऐसा हो जाएगा तो ये better हो जाएगा. I do not know. I have not an answer for it, but I excuse myself, because the target or the end result they want to achieve with the surgery has nothing to do with my surgical skill. That has all to do with Allah has in store for that girl. So I excuse myself कि sir Allah मियाँ बेहतर करेंगे, and Allah मियाँ तो सबके होते हैं और उन्होंने जो नसीब लिखा वो वैसा ही होता है. So that is not the right reason, because you are in for trouble. इसकी example देता हूँ. I think I did the first really nice rhinoplasty I did. This girl came from Sargodha. and I did her, it was a beak-shaped nose, and I did good enough job for that time, like good 5 years ago. And she sent me aamo ke petiyan and all those stuff. Doctor Sahab, you changed my life, this and that. And then 8 months later, she writes to me, Doctor Sahab, you have destroyed my life. मैंने ये surgery कराई थी कि मेरा रिश्ता हो जाएगा, but मेरा रिश्ता अभी तक नहीं हुआ. मेरे पैसे भी waste हो गए. So we have to be very, very clear. Why are we doing a cosmetic procedure? Are we doing it because somebody has self-esteem issues? Because they don't like it, they want to feel better in life, they want to feel happy in life, or they're doing it for something else. Similarly, inappropriate motivations, a lot of good. And you wouldn't believe that they come from all over the world. I have especially a good clientele from UK. The ladies come कि जी हमारे मियाँ किसी गोरी के पीछे पड़ गए हैं, तो आप ये वाली procedure कर दें, ताकि we save our house. So the motivation is wrong. Again, the end product, the end result they want is the husband to behave well, which he would not. I promise you he won't. If he's made up his mind, he will not. So again, a reason for not doing a procedure. I mean, आपके लिए बहुत easy है ये करना because you'll earn money and there's so much money at stake. आप बहुत easily कह सकते हैं कि भी नुकसान तो नहीं हो रहा ना, procedure चाहिए भी और मैं कर भी रहा हूँ, but उसका purpose for getting it done is wrong. So you're doing a wrong thing. Knowingly doing that, I excuse myself. I never do such a procedure. Underlying psychological disorder. When आपको एक चीज़ इतनी बुरी नहीं लग रही, हालांकि I mean, as an aesthetic surgeon, my whole job is to pick defects in people. कीड़े निकल. मैं अपनी वाइफ के साथ जब मूवी देखने जाता हूँ, तो हम बाहर निकलते हैं, तो वो मुझे बता रही होती है कि प्लॉट था, वो कैसी कार है, इस चीज़ में कहता है यार वो फलाने एक्टर को थोड़ा सा फेस लिफ्ट चाहिए था. So that's a hazard, professional hazard we have. So basically, if we think that problem is not that much and the person is overreacting, then I refer them to psychiatrists because we have to find out that it is not body dysmorphia, that they do not have a psychiatric ailment which is making them do a procedure because you're again doing it. And that's the body dysmorphia are the clients जो मैंने शुरू में mention किया था, Michael Jackson's and the actors and everybody, because they keep going back and they keep wanting a plastic surgery. They go to a new person next time, they tell them कि जी फलाने ने ये कर दिया था तो. So they are bad publicity, they're bad for your health, they're bad for their own health. So they need to be checked. So I keep a threshold for sending my clients to a psychologist or psychiatrist very low. I just ask them to get a letter from there that whatever they feel that it's affecting them, will it get better if I do the procedure? If the psychiatrist says no, I don't do it. If the psychiatrist says yes, then I ask them to write down a detailed thing. And wide risk factors, psychological, again, the patient is genuinely worried about something. They really want a change in their nose, the cheeks, the shapes and everything. But आपको पता चल गया है कि this patient is going to be very worried. ये जब तक ये heal नहीं हो जाएगा, results नहीं आएंगे. Results usually do not come immediately. They will cry and they'll make you cry. So ऐसे patients will keep calling you in the middle of the night. So एक patient की मैंने rhinoplasty की again 5 years ago, and by chance last week रात 3 बजे कॉल्ड मी. मैंने कहा जी क्या हुआ है? डॉक्टर साहब मेरे घुटने में दर्द हो रही है, मेरे ख्याल है कि ये राइनोप्लास्टी से रिलेटेड है. एक्चुअली इट हैपेंड. आई एब्सोल्युटली आर नॉट मेकिंग इट अप. तो बेसिकली यू हैव टू असेस कि ये बंदा आपको बाद में कितना तंग करने वाला है या खुद कितना तंग होने वाला है, एंड यू हैव टू एक्सक्यूज. सो हमने इसका जो फॉर्मूला बनाया हुआ है, दैट इज साइमन. दैट इज सिंगल, immature, male, overconfident, narcissistic. So they raise a red flag. These people should not be subjected to a cosmetic procedures. Otherwise, they'll be nightmare for themselves and for you as well. So this is the fellowship we've just started. We've done 2 of them last year. Fellowship in cosmetic gynecology. So Dr. Isabel is with me. Dr. Suleiman from Turkey is with me. She's from Portugal. And we're training gynecologists all because gynecologists are the best people to do these things than us, because they can do lasers easily. Simple PRP can be done by them. Exposure is not an issue. So we're training gynecologists for this, and we're having another one in March, inshallah. This was last year. I'm founding member. We've, again, starting from microsurgery, hand surgery. I'm a totally aesthetic person. I'm trying to revolutionize aesthetics in Pakistan. So we made the first organization, Aesthetic Surgery Association of Pakistan. And we had a first meeting. We had surgeons from Colombia, from Romania, UK, Bahrain, and Turkey. and it was a fantastic event. Since then, the results of most of our plastic surgeons have really gone up, and we're having the next one coming this year. All this is held in IMC Integrated Medical Care Hospital, where I practice now. It's a state-of-the-art facility in DHA Phase 5 on the back of Lumps. Really nice. I'm one of the co-owners of the hospital as well. So this is what is all about aesthetics. That is we're doing it in Pakistan. बहुत अच्छे से मैं खुद अपने आप को लगाता हूँ. I told you. हाँ, because मुझे बहुत हेडेक रहती है. I do it my occipital and go with my temporal. Works like very well. Okay, stress incontinence में डॉक्टर साहब हमें we always have to categorize and grade the deformity. अगर obvious deformity नहीं है, laxity नहीं है, prolapse नहीं है, तो erbium YAG laser and photona laser, we have it in Hamid Latif Hospital, and we're getting one in IMC, and I've got a clinic in Islamabad, वहाँ भी है हमारे पास. The laser works like magic, क्योंकि वो pelvic floor, no last नहीं जी, वो pelvic floor basically it stimulates pelvic floor, and उसके बाद you have to keep doing pelvic floor exercises to keep it competent, so it keeps it going. अगर फिर भी नहीं होता तो of course that is a proper prolapse. Then you have to put then that is not aesthetic gynecology, that is basically functional gynecology, and I'm not. मैंने बताया बेटा आपको कि pelvic floor जो stimulation वाली हैं वो जो photona है that is available in Hamid Latif, and वैसे stimulatory जो workshops हैं वो mostly physiotherapy centers में, even IMC hospital में भी हाफिज आसम साहब की team is doing it regularly. So सर मैंने कहाँ से खाना है? so yes, they'll have to come to me, but you're right, so we do not change the gene. Actually जो next population है उसने तो वो वैसे ही आएगी. जी eye bags sir basically again हम उसको grade करते हैं. अगर सिर्फ tear tough deformity हो, just tear tough deformity, तो we put filler very deep in, but it has to be done by somebody very expert. मेरे पास एक पिछले दिनों एक international traveler आई थी, Catherine. So she had done her fillers from Los Angeles, but she was traveling here, तो उससे वो बढ़ जाता है. So अगर tear trough हो तो you just do the filler. इधर फिलर करते हैं, tear trough उठ जाता है तो आई बैग्स मर्ज हो जाते हैं चीक के साथ. अब उससे अगर सेवेयर ग्रेड है तो आप उसको मास्क कर सकते हैं बाय फ्रैक्सल लेज़र, कि आप स्किन को टाइट कर देते हैं ताकि वो थोड़ा बहुत, क्योंकि एक्चुअल आई बैग इज बिकॉज ऑफ द वीकनेस ऑफ द सेप्टम. Eyelid, septum is the only ligament which is attached on one side to the bone and other side it's free to the eyelid, and वो bone से detach हो जाती है. That's what causes the eye bags. It's not the increase in size of fat. Fat तो हमारी वैसे भी lifestyle के मुताबिक swell और shrink होती रहती है, but जब वो septum depress हो, so ideally that should be corrected. ठीक है. सो वो फ्रैक्सल लेजर स्किन को टाइट कर देती है, 6 to 8 months निकल जाते हैं. बट प्रॉपर आई बैग्स, व्हेन आई से प्रॉपर आई बैग्स, जिसके ऊपर भी एक लाइन बन जाए और नीचे भी एक लाइन बन जाए, दैट आई बैग नीड्स सर्जरी. इट वुडंट गो अवे विद एनीथिंग एल्स. सर बेसिकली वही ना, फैट उतनी ही रहती है, इट स्वेल्स अप, और चूंकि वो जो है सेप्टम वीक हो जाती है तो वो उसको पुश फॉरवर्ड कर देती है. सो वी हैव टू करेक्ट इट, बट ऑफ कोर्स आफ्टर जो है ना नॉर्मलाइजिंग द डिजीज़, पहले ऑप्टिमाइज करें डिजीज़ को, अदरवाइज इट विल हैपन अगैन. कोई अच्छी एडवाइस नहीं. फेशियल वाइटनिंग, अच्छा बेटा मैं आपको बताता हूँ, फेशियल वाइटनिंग नहीं होती, याद रखिएगा. हमेशा एक टोन रिड्यूस की जा सकती है, बट दैट इज़ ओनली बाय मेकिंग द थिन स्किन थिक. आपकी एपिडर्मस होती है और डर्मस होती है. डर्मस के पेपिलरी लेयर में जाकर मेलानोसाइट्स होते हैं. अगर आपकी एपिथीलियम को कोई चीज़ थिक कर देती है तो आप समझें कि एक थिक लेयर बिटवीन योर एक्सटीरियर एंड मेलानोसाइट्स आ जाती है, सो इट बिकम्स लाइटर. सो वी कैन मेक इट लाइटर बाय ग्लूटाथियोन, एंड फ्रैंकली इट्स
आर्बुटीन और
ग्लूटाथियोन जी. उसमें जी आपके विटामिन सी होता है, हाइलुरोनिक एसिड होता है. सो ऑल दे डू इज, एक तो ये एंटीऑक्सीडेंट्स हैं तो दे इम्प्रूव मेटाबॉलिज्म. टू बी वेरी ऑनेस्ट फॉर फीमेल, नहीं सर ये नहीं कर सकती ना, वो तो ट्रांसअमीन होती है ना, वो तो ट्रांसअमीन होती है जो जिसकी आप बात कर रहे हैं. मेलानोसाइट ट्रांसअमीनेज की जो कन्वर्जन होती है वो ये करती है, ट्रांसअमीन करती है. जो ग्लूटाथियोन है दैट ओनली थिकन्स द स्किन एंड मास्क्स द मेलानोसाइट्स व्हिच आर इन द डीपर लेयर ऑफ द. सर इसका दूसरा इफेक्ट एंटी इन्फ्लामेटरी होती है ना, वो कैस्केड. हाँ कैस्केड, यस एब्सोल्युटली. जो भी मिलाजमा के लोग हैं, आई डोंट डू प्रैक्टिस डर्मेटोलॉजी, लेकिन अगर कोई मुझसे मशवरा लेता है तो ओरल ट्रांसअमीन हैज़ द बेस्ट इफेक्ट्स फॉर मिलाजमा. 500 milligrams OD. हाँ, you can even take it for 6 weeks.
कितनी देर के लिए?
जी,
कितनी देर के लिए?
6 weeks.
6 weeks.
जी.
सर पीआरपी के प्रोसीजर में इसको इंजेक्ट कर सकते हैं?
देखें डॉक्टर, देखें बहन, PRP is contraindicated in melasma. That's what I tell everybody. Because उसमें growth factors हैं, वो आपके melanins को growth करा देगा अगर वो melanin तक चला गया. It has absolutely no role in melasma. हाँ, irregularities के लिए yes, it will cause the pores to contract, उसके मतलब रोल है, अदरवाइज इसका कोई रोल नहीं है. कर सकते हैं इंजेक्ट से ज़्यादा अगर आप उसको मीज़ोगन के जरिए मीज़ोथेरेपी कर दें तो दैट इज़ मोर इफेक्ट. इट इज़ एंटी इन्फ्लेमेटरी. सो प्रो ओपियो मिलानोकोर्टिन इज़ द मॉलिक्यूल दैट हैज़ द सेम प्रिकर्सर एज कोर्टिसोल. तो जब आपका जो है स्ट्रेस की वजह से, किसी भी स्ट्रेस की वजह से कोर्टिसोल लेवल जो है वो बढ़ते हैं, तो साथ ही मेलानिन भी प्रोडक्शन बन जाती है, क्योंकि प्रो ओपियो मिलानोकोर्टिन इज द सेम मॉलिक्यूल विच फॉर्म्स कोर्टिसोल एंड विच फॉर्म्स द मेलानिन. सो मेलानिन पिगमेंट, तो बेसिकली ट्रांसमीन जो है वो एंटी इन्फ्लेमेटरी इफेक्ट से प्रो ओपियो मिलानोकोर्टिन की प्रोडक्शन को डिक्रीज करती है. सो दैट्स हाउ इट रिड्यूसेस द मेलानिन एक्ट. इन कॉस्ट तो बेसिकली इट ऑल डिपेंड्स अपॉन के हम कितने लिटर्स कर रहे हैं. Ideal safety limit is 5. International literature, I do it till 8 because I've been doing it for long. अगर देखें जी, अगर एक से ज़्यादा सिटिंग की ज़रूरत है, that means the patient is not a candidate for liposuction. That's exactly what I said. That means कि वो obesity है. Then he should consult a bariatric surgeon or an obesity metabolic surgeon for that. वो weight reduce करे rather than fat reduce करने के. ये सिर्फ body को shape देने का तरीका है. So I never encourage anybody with a BMI of more than 30 to have liposuction done या tummy tuck done because there will be failure. Results अच्छे नहीं आएंगे and the patient client will. सर आप दो तीन कॉम्प्लिकेशंस जो लोग मेंशन करते हैं, दे आर ओनली इन वर्स हैंड्स. ठीक है जी. इंटेस्टिनल परफोरेशन हुई पाकिस्तान में 2 पेशेंट्स की, अगेन शार्प कैनुलास विल यूज विच इज नॉट यूज्ड. ठीक है. सो एक्चुअली वो कॉम्प्लिकेशन नहीं थी, दैट वाज अ टेक्निकल एरर. उसके अलावा लोग कहते हैं जी फैट एम्बोलिज्म हैज़ नॉट बीन रिपोर्टेड इन लिटरेचर. द ओनली डेथ एंड फैट एम्बोलिज्म हैज़ बीन रिपोर्टेड इन ब्राज़ीलियन बट लिफ्ट. ब्राज़ीलियन बट लिफ्ट में चूंकि आप ग्लूटियस मैक्सिमस के नीचे फैट इंजेक्ट करते हैं, तो इट्स हाईली वैस्कुलर, सो यू कैन इंजेक्ट फैट इनटू द ब्लड वेसल्स एंड वहाँ से द डेथ्स हैव बीन रिपोर्टेड. सो अदरवाइज कोई मोर्टालिटी हैज़ नॉट बीन रिपोर्टेड विद इट. ग्लूटाथियोन, हाइलुरोनिक एसिड एंड विटामिन सी ये होने चाहिए. और मैं टू बी वेरी ऑनेस्ट, आई आस्क गर्ल्स एंड वुमेन टू maybe use capsules or one while just drink it once a week, क्योंकि ये menstrual cycle को improve करता है. antioxidant effect इसके बहुत अच्छे हैं. I've seen even जो है ना systemically melasma get down, यानी stress और जो है polycystic ovarian disease में भी I've found it useful. So it is glutathione. सर उसके बारे में बड़ी myths हैं कि इसके side effect, कोई side effect नहीं है. It's a good thing. Sorry. कैप्सूल भी वही ना, ग्लूटामैक्स, उसमें भी सेम चीज़ है. वो कैप्सूल फॉर्म में और इंजेक्शन वाले इंजेक्शंस में हर चीज़ के आते हैं जी, हर जगह के आते हैं. स्विस कंपनी के आते हैं और स्विस ही उसका नाम है जी. ग्लूटामैक्स आता है न्यूट्री फैक्टर का.
थैंक यू वेरी मच.